Well, good morning, Queensland. I can report 2 new cases today, one in hotel quarantine, and they were acquired overseas, so we're not concerned with that one. We do have one new community case, and I'll come back to that in a moment. So that puts us at 43 active cases. We've had 16,020 tests in the last 24 hours and 11,715 vaccines, and we now have 1,848 people in home quarantine. And now this one new community case is very new as far as the information we have. So my message to everyone is please keep an eye out on social media and the Queensland COVID website today as more information becomes available. What we do know is that it is a 17-year-old female. She's a student at Indooroopilly State High School, and that she became unwell yesterday and went and got tested, and overnight her result has come back positive. We are testing her family members. It's a family of 5. They live at Turinga. We're aware and we're treating this as if the young lady was infectious from the 27th. So she's been in the community for 3 days and at school for 2 days. So I understand the schools already notified families and are closed down for a deep clean. There is very little more information at this stage, so we need to still identify exposure sites. At this point, we understand the family hasn't travelled anywhere, and we are still to get the genome sequencing to find out what variant it is, and also whether it's linked to any other cases in Queensland or Australia. I'll now pass over to Dr. Young, but my message is clear. Because this is an unknown, unlinked case at this stage, until we get more information, masks are more important than ever, social distancing, good hygiene, and please, if you live in the Brisbane area or you've been in the Brisbane area for the last few days or anywhere in Queensland, if you're unwell, go get tested, but please check the Queensland website for any exposure sites as more information becomes available throughout the day.
So one new community acquired case, which is quite concerning because I'm struggling to understand how she's acquired it. So we'll have to wait till we get whole genome sequencing results back later today to be able to work out from where she's got this. So we do know that we have had 13 incursions of the virus into Queensland over the last 6 weeks. And we know that in any particular outbreak, someone can get infected, not have symptoms, and then spread the virus to someone else, which is why it's critically important that we all remain very, very cautious until the vast majority of people have been able to be vaccinated. So masks, maintaining social distance, being careful when you're out and about, all of those things are critically important as we move forward. And please, anyone who is 60 years of age or older, you are the most at-risk group. We know that you're the group that if you get infected, you do have a high risk of getting severe disease and potentially dying. So please, if you have not been vaccinated, the vast majority have, which is excellent, but if you haven't been, please go and see your GP, go to one of the pharmacies, one of the vaccine clinics, and avail yourself as soon as possible of the AstraZeneca vaccine, which is available. We have plenty of AstraZeneca vaccine available out in Queensland. Thank you.
Yesterday at our road borders we intercepted 4,076 vehicles and turned around 36. We turned around 36 heavy vehicles, and obviously for our truck drivers out there today, there is a new regime that came in from 1 a.m. this morning. They need to understand their obligations in that, but we will work through that with them if there are any issues. Domestic flights, we processed 633 passengers, turned around 8 and put 170 into hotel quarantine. Pardon me. 195 persons arrived internationally. We did issue 5 penalty infringement notices yesterday. We saw 3 people come into the state giving false declarations and then have been identified by police and fined $4,135 each. So please do not do this. This carries serious consequences. Plus you run the risk of being put into hotel quarantine at your own expense for 2 weeks. We saw one person breach home quarantine. Now, for the people that do go into home quarantine, we do check, we do make sure you are there, make sure you abide by those requirements. This person actually had a reason for their visit their elderly mother. Notwithstanding, they have been fined $1,378 because that was not a lawful purpose. If you need assistance, please reach out. I'm going to finish on masks. Yesterday we handed out 49 masks and we issued one penalty infringement notice. We have seen some imagery in the last few days of people not being compliant with masks. Police have been asked to increase presence in areas where people may not wear masks and also to increase interaction with the community. So we expect our police to be out there and about really checking people to make sure that they have their masks on when they should. Thank you.
Dr. Young, can you walk us through the process, obviously early stages, but what's the process now like for school and what's the parents know?
Right, so this 17-year-old young woman attends the Indooroopilly State High. As soon as we became aware of the case, the public health unit contacted the school. In fact, I think that was a bit after midnight they did that, and the school was so proactive, immediately let all of their students know that they would not be coming to school today, so the school is being closed today, so there can be cleaning, and also so we can go and contact trace and work out which students need to go into 14 days quarantine. Partly we'll also be able to get back the whole genome sequence result to work out the risk there, to work out which students will need to quarantine. And also we'll then find out how the student travelled to school, whether there was interaction with school kids from other schools. All of those things will be happening as we speak now. We should get it back late today. I mean, it takes usually 24 hours, but our team's become really good at doing this, and they would have started last night.
So not sure yet if she took the bus to school.
No, all that work is happening. We only found out, I mean, she only got tested yesterday.
Look, on the vaccines, I saw there was some data published in the Lancet from Europe where they did a study of 1.3 million people, and they found the instances of blood clotting in Pfizer and AstraZeneca was about the same, about 1.3, and actually the instances of blood clotting in people who tested positive for COVID was 8 times higher.
Yep.
Will that change your opinion at all?
You're very accurate. Yes, we've been aware of that data, of course, for quite some time. The clotting that I'm worried about, that we're all worried about for AstraZeneca, is different to that. So lots and lots of Australians get blood clots in their legs, deep venous thrombosis, pulmonary emboli all the time. It's actually quite a common health condition. This other condition, the TTS, thrombosis with thrombocytopenia syndrome, is quite different. And it's a specific syndrome that's related to very few causes. One of them is heparin, so heparin can cause it. Another is the AstraZeneca vaccine, also the other adenovirus vaccines. So we've also seen it with some of those other ones. We haven't seen that specific syndrome with Pfizer or Moderna or the mRNA vaccines. But you're absolutely right, you are very correct. Pfizer and AstraZeneca don't increase the risk of those other types of clots, of that usual DVT pulmonary emboli type clots.
So in terms of this data, it's unlikely to lead to a change in advice for who should be having AstraZeneca?
No, that data came out quite some time ago, and that was why Europe initially stopped use of the AstraZeneca vaccine for certain age groups, but when they did more work, and that's what you're quoting, they found that there wasn't an increased risk. So the risk from AstraZeneca causing TTS is quite a different syndrome to the descriptions you've just read out there, but you're very correct. The risk of general blood clots is no higher with the vaccines compared to the normal risk in the population.
Is there an update on the backpackers? We've got those test results back yet. How are you feeling about that situation?
Look, that backpacker hotel has done an absolutely first-class job, so we're now working with them to maintain quarantine for the remainder of those 14 days for the guests there. So we'll just continue to work that one through.
Have you tracked down any other people who stayed there and how long they stayed?
Yeah, that's the work that's happening today. I don't have any more, no.
confident that it's under control?
That's probably too strong a word. I'm comfortable that we're doing what's needed. We will just have to see what happens over the next few days. Remembering that's an alpha variant, and so I wouldn't be surprised if we get cases in the next 10 days.
Has the young been moved out of that hospital given the difficulty of social distancing in a facility like that?
No, we've moved the case out, of course we have, but we haven't moved the others because of the tremendous work that we've been able to do with the manager of that facility, and we've put in more health staff to support that facility. We think that's probably an appropriate place for those people to remain, and we'll just test them more frequently than we would normally.
As a student, what kind of symptoms did the student have, and did they report to the how did that all evolve?
Right, we're sorting all that through. I understand that she had a headache, but all that's very early information. So we only found out that she was positive very late last night. We now need to work through all of that.
And early days, but you said you were struggling to understand this one. Could you just talk us through that?
Well, she's a 17-year-old young woman who goes to school, so I'm not sure how she's got it from all of the other clusters that we know about, but clearly she has, and whole genome sequence will help us work that through. No, she's now in hospital. So she's a confirmed case. All our confirmed cases in Queensland, except some of those that are still on that boat up on the up near Weipa, all of our confirmed cases at this stage in Queensland go into hospital.
Did you receive a reply from the NRL about the email that you reached earlier in the week with what's happening?
Yes, I got that reply. I'm losing track of days now. I think that was yesterday, and then we responded. It might have been the day before, I'm sorry, and we responded, yes.
Has anything changed, and have they made us now allowed to
Yes. So they gave me a reason for why that young man had breached the requirement, and it sounded a reasonable, I could understand why it had occurred. So now, given that all of their players and families have tested negative day 5, I've said they can have access to the balconies again.
That's what we got this
You've announced a $165 million hospital payment. That's a pretty convenient funding.
Look, I don't consider it a grilling. I consider it an important part of my job as the Health Minister to make myself available to answer questions on expenditure in the health portfolio. But look, we've been working since the budget came down on the funding that was allocated to deal with the demand pressures that are in our system. We've been working through a lot of information with our hospital and health services about how we provide the bed capacity, and also working with our private providers about standing up this bed capacity with this additional funding that we've got this year. So I'm pleased to announce it today, and I'm very pleased that the majority of those beds will be coming online in the next 4 weeks, and then of course over the coming weeks. But of course this is in addition to the 100 million that we announced back in April as well, in putting in place a whole lot of initiatives to start taking pressure off our hospital systems, which are seeing significant demand, more than they've ever seen before. Thanks everyone.
From that, because last night was a pretty bad one. There was in terms of ambulance wait times, there was one patient waiting 2 hours last night.
Oh, look, I'm happy to look at the circumstances, but I don't even know which hospital you're talking about. So, it's, well, I'll be going through a lot of that in detail over the next 4 hours. So, thank you.